I'm Sue O'Connell. Tonight on Greater Boston, with Mass General Brigham residents, interns, and fellows at odds with hospital leadership over union efforts, I'll talk to one of the resident physicians behind the push and a Boston City Councilor lending her support to their fight. Then Boston travel writer Christopher Muther on the house that got him through the pandemic, the best drinks to order on a plane, and what on earth is that new big red building over at Logan? Burnout has always been a problem for healthcare workers for whom long hours and stressful days are just part of the job. But, of course, the pandemic has made everything that much harder. And in response, doctors, nurses, and other medical staff have been leaving the field at alarming rates. It's also prompted a wave of unionization efforts among those left behind, including here in Boston. At Mass General Brigham, the healthcare network behind Brigham and Women's and Mass General hospitals, among others, residents, fellows, and interns have signed their support for a union. And because Mass General Brigham has refused to voluntarily recognize them, organizers are looking ahead to formal election overseen by the National Labor Relations Board. The effort has gotten backing from city leaders like City Council President Ed Flynn and City Council Ruthzee Louijeune, who have joined residents, fellows, interns, and union advocates to show their support. Councilor Louijeune joins me now, along with Dr. Sascha Murillo, internal medicine resident at Mass General Hospital and one of the leaders behind the unionization efforts. I should note, we also reached out to invite a representative from Mass General Brigham to join us. They declined. They did send a statement instead, which I'll get to in a little bit. Welcome to both of you. Doctor, I want to start with you first. Can you tell us what the issues are that you're facing that you feel are not being addressed, so therefore you're looking at a union?
Absolutely. And thank you for having me here today. I think a lot of the challenges that we face as residents in the healthcare system are pretty universal across the country. We work long hours. We work 80 plus hours many weeks in the year. We often face, poor working conditions. I know many of my colleagues have spent a night on a yoga mat on the floor and haven't had access to call rooms when we're doing 24-hour shifts. And then there are, your benefits and salary. We live in one of the most expensive cities in the country and struggle to pay our rent when we're saddled with hundreds of thousands of dollars in debt, are also foregoing, earnings in other fields and don't have access to retirement benefits, much like other people our age in other industries. So those are just some of the things. So,
Doctor, as I'm kind of parsing through this and reading some comments and talking to older doctors and older people in the healthcare world, some of them are saying, look, this is just how it is. This is how it's always been. None of us got any sleep while we were residents. All of us have lived in Boston, which has always been expensive. Why is it different for your generation, they might ask?
I think that, when we say we've done something one way, we should always question why. And is this really the way that we need to continue doing things? I myself am training to be a primary care doctor actually in this city. And most of my training is spent in the hospital because I know that is where the hospital makes the most money from my labor, is by me staffing their inpatient units, their critical care units. But really, I think that we need to rethink residency training and who is it really for? Is it for the hospital or is it for us?
This is the response that we got from MGH Brigham. They sent this to us earlier today. While we share the common goal of offering a world-class, comprehensive, and supportive medical education experience, we believe we can achieve the best results by working together in direct partnership rather than through representatives in a process that can lead to conflict and potentially risk the continuity of patient care. We are committed to continuing our dialogue with our trainees and building on a number of achievements, including market-leading increases in compensation, retirement savings, and health care. Councilor, what's your response to that statement from the hospital?
Well, I actually think the good doctor said it the best way. These doctors have been doctor trainees, residents, interns, fellows sacrifice a lot for patient care. I don't see any way that supporting a union is disruptive of the continuity of care for our patients. If anything, it helps to preserve and ensure that we are giving the best care possible to our patients, because doctors are well rested. Doctors feel like their employer cares for them. Like, we benefit everyone when we stand in solidarity with workers, whether they're doctors or folks who work at the local convenience store. Unions are there to fill that gap when employers aren't centering the needs and the desires of workers, who are really an important part of making sure that we are being efficient in that patient care. So I would just disagree and support the dedication and commitment of these doctor trainees in organizing and in fighting for their union.
Councilor, what are you seeing around the city regarding union organizers and organizations? You know, we're in an odd place in the United States where the power of unions nationally seems to have decreased, and union membership has decreased. And, you know, my dad was a Teamster in the 1960s, and my mom was a shop steward, and I don't think I know anybody who is in a union, having grown up surrounded by people in unions. Yet we see a younger generation of people, both doctors and Starbucks workers and folks all around the city, trying to get the unions back up and being helpful again. What's your take of what's happening?
Yeah, first of all, Boston is a union town, and we are here to stand in solidarity with our workers. I think it's really important that we say, you know, whether they're doctor trainees, like I stated, you know, folks who have, you know, spent a significant amount of time in school and are now out there to become doctors, or whether you are a nursing assistant or a janitor at the hospital. We need to make sure that we are filling and standing in that gap so that workers aren't subject to the whims of corporate greed. And so it's important that we stand in that gap. And it's not just happening in the city of Boston. We see it happening with Amazon. We see people realizing that if we are not standing up for ourselves, then we're just railroaded. So it is important that we stand with workers, and that we stand with workers' ability to unionize, so that folks can have living wages, family-sustaining careers, benefits, and that they are able to retire with dignity. And we all need rest. None of us are just meant to be cogs in a wheel or widgets. We are people who require rest. And, you know, the good doctor also said, just because something's been done one way does not mean that's how it must always be done. I am a lawyer by training. There are certain things that I did as a lawyer in my training, having taken the bar, that I think we need to redo so that the next generation doesn't have to put up with the same challenges. We need to make sure that we are infusing more compassion into our systems. And you do that with unions. Unions recognize that workers are people and humans who deserve to be valued, when systems sometimes just see individuals as cogs in a wheel. And so I stand incredibly with our interns and our fellows who have taken the extreme example, what we see now, of courage and dedication. They're already working so many hours a week, and on top of that, they are organizing. And I just want to say, my sister organized her workplace with the Teamsters last year. So the Teamsters are still around and they're still kicking. So,
Dr. Murillo, I want to ask you a couple of pushback questions from folks I've talked to and some research I've done. People are concerned. I mean, I can't even get into the idea of doctors working an 80-hour week and then telling us that we shouldn't be working an 80-hour week. Definitely falls into the practice what you preach situation. And any of us who have looked in the eyes of a doctor who we know have been working more than, 60 or 70 hours in an emergency room does not make me, I know how stupid I get at the end of the night when I haven't had a lot of sleep. But nonetheless, if we agree that those hours are too much, there's concerns that would change the entire shape of a residency program, that will not give you enough time to learn what you need to do to be a very good doctor. What's your answer to that?
Absolutely. I mean, I would like to push back on that in a few different ways. I think there's respecting the limits that we've set forth. Sometimes there are individuals who, the ACGME, which is sort of the accrediting body of residency programs, sets an 80-hour work week limit. And yet many people in some surgical specialties, for example, will go beyond that and will underreport their hours. And so we're asking, that we just sort of at least respect the limits that we set forth. That's, I think, number one. And then two, I think it's like, as you said, how much are we learning if we are, burnt out at the end of an 80-hour work week? And at some point, so much of our work is a lot of, is leading to burnout fields beyond residency and at levels beyond residency. We're dealing with a lot of paperwork, a lot of prior authorizations to try to get our patients the medications that they need. We're dealing with a lot of other systemic barriers that are also, impacting our education already. And so, I think that the 80-hour work week is really just sort of like an arbitrary determinant of how much education we're actually getting, and the quality is what matters.
What about the issue of who pays for it? So if we all agree that you should be paid more, and we live in a country where we're all paying for our own health care one way or another, where would the cost get absorbed for paying more for residents' work?
I think that can be answered on a few levels. I think that clearly our hospital system has the resources to do this. Just under the threat of a union, they were able to find the money to be able to offer us already salary raises for the next year and other increased benefits. But I think on a larger scale, the federal government has underfunded residency for many years. We have not increased the number of residency spots, I think, since the 80s. And so in a country where our healthcare needs are getting more and more complex by the decade. And so that has not changed for many years. And I think ultimately another answer needs to come from above as well.
So as folks who watch the show or pay attention to me know, my family uses healthcare a lot. I've got a kid with a chronic illness. We have at least 3 doctor's appointments a week. It is hell trying to get appointments. She's had 3 primary care doctors in 2 years. People are leaving. And just the administrative folks who are trying to do their best to get appointments, it's a nightmare, right? And this is in Boston, in one of the greatest hospitals in the world. Doctor, what's your statement about, are you feeling like you're in a position of power because of the retirements and the burnout, that you're hoping that this leverage will allow you to get what you want without having to go to a union, or do you think the union is the path that you're going to take?
I think the union is the path that we need to take. It's the only path where we can ensure that these benefits will live on in perpetuity. It's the way that we feel that we have agency. And, when we're faced with burnout, we feel empowered when our voices are respected. I take issue actually with a part of this, many parts of the statement, but in particular, the statement that I think that MGB put forth that suggests that there is some kind of interloper that sort of negotiates our contracts. We are the union. The residents form the union. We're asking for a direct partnership as a union. And we think that is the most effective way to make sure that our voices are heard, and to use this platform to really advocate for our patients as well. We're the ones on the front lines, along with nurses, PCAs. We see the issues day to day, and so many decisions come from the top down. And we really feel that this is our platform where we can raise some of those issues across the system.
Councilor, one of the underpinnings of this conversation, too, is housing and how expensive it is to live here in this city, wanting to attract world-class people to work at a world-class hospital, and they can't afford, even with a good salary, maybe not enough, but still a good salary, you can't afford to live here. Does the city council, when you're dealing with corporations and hospitals and the colleges here quickly, does this come into play that we've got to do something about housing if we want to keep people coming here and working here and living here?
Absolutely. It's a question that we deal with all the time. It is that we are the second most expensive city to rent. You have to make more than $180,000 if you want to purchase a home in the city of Boston. It is something that we are grappling with. More than half of the city's allocation from the federal government are ARPA dollars. We allocated more than $200 million to housing, both rental and home ownership, to try to grapple with this problem. And tomorrow on the city council, I'm co-sponsoring a hearing about payment in lieu of taxes. A lot of our hospitals and universities they have nonprofit status here in the city of Boston, which is depriving us of tax revenue because they don't pay taxes. And so there's a payment in lieu of taxes program that requires them to either pay into the city with community benefits or cash payments, and not all of them honor that. So it's those payments that can help us do the work of building more affordable housing, building more housing in general, right? We have both an affordability issue here in the city and a construction issue. We need to be building more housing. And so we need to tackle both of that. And we're doing that on the city council alongside Mayor Wu, acknowledging the work that we need to do to keep the good doctors like Dr. Murillo here and to make sure that folks don't feel overburdened. And so we're doing what we can. Of course, there's more to be done, but we're all here to do the work.
Super quickly, Dr. Murillo, what's the next step?
The next step is that we are asking for MGB to work with us swiftly so that we can get to an election before the end of the academic year in June. Right now they are engaging in some union busting activities, sending emails, trying to, discourage people from supporting our union efforts. And we really want to just work in good faith and get to an election quickly.
Well, I thank both of you for joining us, and good luck to both of you.
Thank you both.
Thank you, too.
Next, while doctors struggled through the pandemic, so did those of us stuck at home. There are really only so many hours of Netflix that you can watch and so many walks around the neighborhood you can take, or catch-up phone conversation with friends you can have before you start to really lose your grip. And for Boston Globe travel writer Christopher Muther, home was both where he rode out his lowest moments and found salvation. In one of his latest for the Globe, he looks back on the early days of COVID when he and his husband, who's a doctor fighting the disease on the front lines, found their dream home just when they needed it most. He now credits the house and the renovations that they made to it with bringing him back to his feet, writing, "I thank the house every night for the first year we lived there. I like to think that if it could, the house would say, thank you, the way that I often thank the house for saving me." Christopher joins me now for more on that journey and some travel trips for your next one. Christopher, welcome. It's so great to see you. Thanks for joining us.
It's great to see you, Sue.
And thanks so much for sharing in that article, talking about our mental health, your mental health. And before we jump into the house aspect of it, what does Catherine Zeta-Jones have to do with you?
Back in 2011, Catherine Zeta-Jones was on the cover of People magazine talking about her private battle with bipolar 2, which I thought maybe it's not a private struggle if she's on the cover of People magazine talking about it. So bipolar 2 is sort of a variation of the bipolar we all know. It means the depressive periods are a little longer and the manic episodes aren't quite as spiked. So to jump in and, talk about Catherine Zeta-Jones in context and not, Chicago or other things she's done. At the same time that she was on the cover of People magazine revealing her diagnosis for bipolar 2, I was also diagnosed with bipolar 2. And, over the years, that was 2011. So over the years, I managed to find medications that help me and allow me to sort of function day to day as well as any of us can. But I think that brings us up to the house in the pandemic, where during the pandemic, as many of us struggled, I think those of us who have mental illness might have felt it a bit more. And that was definitely the case for me.
And also, like you, when you have a job that has you doing things outside, folks asking a travel writer, so what's it like being stuck at home during the pandemic? I mean, I think I actually had you on one of my shows and asked you, what's it like, Christopher? Now I feel bad. Being stuck at home.
I was referring to you, Sue, in that particular line.
But the house that you and your husband, found and purchased, which we could go into, I'm sure, a whole nother episode as to the trauma and delight of doing that. What was it about the renovations of the home that really kind of felt your soul and kept you grounded?
I feel like we found this house. We're in Metro West now. We found it in sort of the lower points of the pandemic. We found it in the summer of 2020. We moved in November 2020. And before that time, I'd been really struggling, as a travel writer who's grounded, thinking I would probably get fired any day because who needs a travel writer during a pandemic? And then also just kind of losing my sense of identity because, your job is often kind of connected to who you are, or often you feel that way. So when the house came along, it took us out of South Boston where we were living, and it sort of gave me room to breathe And at the same time, it gave me the distraction that I definitely needed. Sorry, go ahead.
No, I was just going to say, Christopher, that it's also, in my experience, also with, my challenges and the people around me, finding where your special power, where, your mental health orientation is kind of how I look at it, where you can best use those positives. I mean, I think every person I know who is on the bipolar spectrum does great stuff with their house, right? Or great stuff with their yard, or great renovations. I'm on the attention deficit disorder spectrum. I don't have the attention to do any of that, so I'm always amazed. But do you feel like it really is taking your mental health orientation and using it as a superpower?
I mean, it's an interesting question. I feel like maybe on the manic swings, it helps a lot. I often joke that that's when our house is the cleanest, when I'm experiencing a manic episode. But, I think really kind of my superpower in all of this was I was someone who was never home before the pandemic. And suddenly I was home so much that I kind of became obsessed with the idea of it. Once I sort of got through the trauma of being home, then I kind of loved it. And so then, the house really became the center. And I feel like that's when sort of I had found my groove. And, the other thing too is the house is a 1965 deck house. And I often refer to it as the Brady House. Mm-hmm. Because it has that kind of great look about it. And I'm obsessed with anything mid-century related. So it really just gave me the perfect springboard. And also, I'm a really kind of intense person when it comes to research because of my job. And I went off the rails researching mid-century furniture for the house, which is what saved me through the 2020 election. I had that distraction leading up to it.
And you ended up with a beautiful bathtub. We ended up, with a president, and you ended up with a bathtub. I think it's even. It works out. I think it's fine.
I would trade the bathtub, but that's another story.
Well, thank you. Thank you for sharing it. It really is helpful to all of us. Let's switch gears and talk about Logan Airport. There's this big red building there. Apparently, Boston has a color, and apparently it is part of our new Generation 4 Logan Airport. What's going on there?
Well, I spoke with the architect of the building, which is very kind of Jetsons-esque. I think it kind of looks like a spaceship that's landed at Logan, but I kind of love it too because it's so distinct. The architect, his name is Luis Vidal. He is based in Madrid, but he also bought a house in Boston through this process because he just liked the city so much. One of the things he did was he patented a color, Boston red, which he based on things like the bricks, sunsets, even the Red Sox. So he spent 3 days in a lab in Switzerland coming up with a color that he thought would work. And so it's Boston red. No one else can use this color unless they have permission from him.
It was also interesting in your article in the Globe about his perspective on the passengers and who they belong to, which I was really struck that, the city thinks passengers belong to us, the airports, the airlines, and yet he makes the argument that when you're making a terminal, the passenger belongs to the passenger and they should be front and center in it.
Yeah, the thing about, as you know, terminals have kind of evolved over the years. And I think the one that I've kind of most lived through has been the terminal as shopping mall. Mm-hmm. With, sort of limited dining options, not a lot of, it's a hit or miss when it comes to finding outlets to plug in. It's getting better, but still a bit hit or miss. So if you need to do work. So the idea of the fourth generation airport is that now the passenger sort of has control, that they can decide what they want to do. It's not all stores. It's not just a series of uncomfortable benches at the gate. There's, the idea is there's sort of private areas, like a nook you can kind of hide out in. Mm-hmm. There's also an idea, which I didn't get into in the story, about incorporating more trees, plants, all of that, which calms people down they found through research. So yeah, the idea is that the passenger can make the decisions. The passenger belongs to no one. But, at the same time, that's the fourth generation airport. But they found that when people are in, they have that feeling, they spend more. So it worked out for everybody.
So as I'm complaining about all the stores, I'll be happy about it and just spend more money. All right. So you also did an article recently from the Air Advisor founder, Anton Radchenko, about the best drinks to drink on the airplane. I was hoping it'd be filled with alcohol. We've just got a little bit of time left, but I'm now so thrilled to find out why people drink tomato juice, which they could get at home, but don't, and are thrilled to drink it on the airline. Why are people drinking tomato juice, Christopher Muther?
Isn't that fascinating?
Yeah.
I've always wondered why people order tomato juice. It has something to do with our taste buds change with the altitude, because the pressure, so our noses, the idea is that technically we feel like we have a cold when we're in the air because it's replicating that and drying us out. So there's something about the taste of tomato juice that people crave when they're in the air. And normally mine, of course, is with vodka. Yeah. Theirs is not. So people just get cans of it for some reason. I have no idea why.
Yeah, it always used to crack me up. Also, scotch and soda's on the list, so you'll be covered. Well, Christopher, whether you're in the skies, in a terminal, traveling, or at home in your bathtub, I appreciate you joining us and sharing your insights, and also directing everyone to your great stuff over at the Boston Globe. Christopher Muther, thanks so much for joining us.
Thank you so much.
That's it for tonight, but come back tomorrow for Talking Politics. How much attention do Robert Kennedy Jr. and other fringe candidates deserve? Adam Riley and his panel will dig into that. Plus, online sports betting gets off to a very fast start in Massachusetts. That and more tomorrow at 7. Thanks for watching. I'm Sue O'Connell. Good night.
What would it take